Hello, everyone. This is Mariah Taylor with Becker's Healthcare. Thank you so much for joining us today for our webinar, Inside Renown Health Data-Driven Approach to Staffing Stability. Before we begin, I'm going to walk you through a few quick housekeeping instructions. First, we will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the QA box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access that recording. And if at any time you're having issues with audio or visuals, try refreshing your browser. But if that doesn't work or you're having other issues, feel free to submit any technical questions into the QA box. We're here to help. With that, I'm pleased to introduce today's speakers. First, we have Suzanne Oetjen, Vice President of People Operations at Renown Health. And then we have Tyler Punteney, Manager of Strategy Workforce Solutions at AMN Healthcare. And last but certainly not least is John Fagerland, Senior Product Manager at AMN Healthcare. Thank you so much for joining us, Suzanne, Tyler, and John. We're excited for this presentation, and I'm going to tap it over to Tyler to get us started.
Thanks, Mariah. I'd like to thank everyone for joining us today. We're really excited to walk you through Renown's workforce transformation journey and share some lessons that we've learned along the way. First, here's what you can expect during today's session. We'll start with a quick look at the national healthcare and workforce landscape, what's happening across the industry, and how those trends have impacted turnover and staffing. After that, Suzanne will walk through her story from Renown Health, where they started, the challenges that they faced, and the outcomes that they've achieved through targeted intentional workforce strategies. From there, John will show you the Workforce Planning Dashboard, a critical tool that gave Renown Health visibility into staffing patterns, gaps, and opportunities for improvement. Suzanne will also highlight some of the key strategies and solutions that Renown Health has put in place, everything from float pool expansion to leadership development and employee engagement initiatives. Finally, we'll wrap with a few closing thoughts and open it up for Q&A. The goal today is to give you a practical, transparent view of what's possible when you take a data-driven, people-centered approach towards workforce transformation. With that, let's get started. As we begin, it's important to frame the conversation in the context of what's happening across the industry. The challenges that we're addressing today are not isolated. They're part of a much broader workforce story unfolding across healthcare. We see that burnout remains a top issue. In AMN's most recent nurse survey, 58% of nurses reported feeling burned out most days. And what they're asking for isn't surprising. Work-life balance and schedule flexibility consistently rank as one of the top solutions. It's a clear signal that retention strategies need to go beyond wages to address the structural drivers of burnout. At the same time, health systems are facing a financial squeeze. Labor costs continue to rise while reimbursement rates continue to decline. Many executives that we work with are saying what's long been true. Wage increases alone aren't going to fix workforce instability, and they're not a sustainable solution without operational redesign. But it's not all bad news. There's opportunity here too. In our 2025 survey, 77% of nurses eligible for retirement say that they'd consider staying if the role fits their desires and the incentives are aligned. It's a major opening to retain experienced talent, reduce the onboarding strain, and help stabilize our teams. The March jobs report showed healthcare jobs grew at an annualized rate of 3.1% during quarter one of 2025, which is slower than the 3.9% annualized growth in quarter four of 24. Hospital industry job growth through March was 3%, annualized down from 3.4% in Q4 of 2024. Just over 720,000 hires in February was down 3% from January. Hires in February were 3.1% of jobs, trending down and near normal pre-pandemic levels. In March, healthcare jobs were up 3.5% year over year. Growth is still above the long-term average, though growth is starting to slow. This highlights a key shift that we're seeing in the national labor market, especially in healthcare. After years of volatility, attrition has started to normalize to where we were pre-pandemic. In the 3 months ending in February of 25, the total attrition across all healthcare returned to pre-pandemic averages around 35% annually. What's important here, though, is what that makeup of attrition is. Voluntary quits, which really spiked in the wake of COVID, have declined steadily, and we're now trending close to historical norms, the positive signal for stability and retention. At the same time, we're seeing an increase in involuntary attrition, layoffs and terminations, as well as retirement. In other words, some of the turnover that remains is more structural or demographic driven rather than being driven by a burnout or disengagement within the workforce. The shift matters when it comes to forecasting. We're not operating in the same chaotic environment that we were in 21 or 22. Workforce planning models can now assume a more balanced mix of attrition types, which helps us design smarter staffing strategies as we go forward. Taking a look at some of those drivers of turnover, this highlights the operational indicators most predictive of employee turnover, and it helps us shift from a reactive measurement to proactive risk identification. Most significant predictor probably doesn't come as a surprise, but is the seniority of how long somebody has been with your organization. Employees with 3 years or less of tenure are 78% more likely to leave, which reinforces how important early engagement, onboarding, and retention efforts are within the first few years of someone's employment. Beyond tenure, we also see several workload-related tipping points that increase the likelihood of termination. Leakage, which is hours and time not worked against a committed FTE, becomes problematic above 10%, increasing our turnover risk by 40% versus those under 10. Core staff floating above 55% of the time and overtime above 15.5%, both also raise the likelihood of termination by 40% or more. We also see strong associations between high levels of unexpected time off, cancellations, and incidental work time. All of which reflect operational stress or inconsistent staffing models. These are all signals we can monitor in real time, and they allow leaders to intervene sooner with coaching, scheduling adjustments, or workload balancing before a resignation happens. Excessive turnover is not just a staffing problem, though. It's a cost and operations problem with wide-reaching consequences. First, the financial impact. According to NSI's 2025 report, each RN termination can cost an organization over $61,000. That includes recruiting, onboarding, lost productivity, and overtime that it takes to fill those gaps. Second, it's a time issue. On average, it takes 83 days to fill an RN position. It's nearly 3 months of an increased burden on existing staff, increasing the potential for burnout and often decreased continuity in care. Finally, we can't ignore the cost differential between core staff and contract labor. The annual difference between employing a nurse and relying on a traveler is nearly $80,000 per FTE. When you multiply that by dozens or even hundreds of positions across an organization, you start to see how critical retention and workforce stability are to the bottom line. These numbers reinforce why workforce strategy has to be front and center, not just for HR, but for finance, operations, and executive leadership as well. Any workforce optimization journey takes an intentional and phased approach to transform workforce operations, not just solve immediate issues, but to build a sustainable, scalable model moving forward. It starts with clearly defining the vision and goals, aligning on what success looks like, getting that right resource to the right place at the right time for the right cost to be able to provide high-level patient care that your organizations and patients expect. From there, we have to identify key teams and stakeholders needed to support that vision. Leaders from nursing, HR, finance, and IT are all critical to making change sustainable. Then comes the planning phase and building out a structured change management approach. This includes understanding the current state through assessing your operations, communication plans to ensure that everyone understands your why, and ensuring that we have support from leadership all the way down to the unit level. Next, implementation, making sure that you have the right tools and technology to support flexibility, transparency, and deployment of your staff. After that, that's really when we see the outcomes of this journey: increased staffing stability, improved retention, and reduced reliance on external travelers, all while aligning cost and care delivery. The process isn't about flipping a switch. It's about making sure that we build the right foundation and keep people aligned throughout. Now I'll pass off to Suzanne to talk specifically about Renown's journey.
Thank you so much, Tyler. It's a pleasure to be here today. Just a little background about Renown Health. We are located in Reno, Nevada, and we are Nevada's largest not-for-profit integrated healthcare system in northern Nevada. We serve about 100,000 square miles into Eastern California. We are a level 2 trauma center. We have two acute care hospitals, a children's hospital, a rehab hospital, a medical group, and an urgent care. In 2021, we assigned an affiliation agreement with the University of Nevada, Reno School of Medicine, creating Nevada's first integrated health system. We have about 8,000 employees. Of those 8,000, we have 600 employed providers. Renown was experiencing much of what Tyler mentioned earlier on. In 2019, we decided we needed to take a deep dive and look at our workforce and our planning and making sure we're optimizing the best we can on staffing and giving the power to our employees to schedule themselves most appropriate to their competencies and skill mix. We were experiencing in 2019, even before the beginning of the pandemic, several of what I know most healthcare organizations were experiencing at the time. Staff burnout, not a great line of sight to see what our skill mix was, really having a challenging time getting our clinicians at the right place at the right time. And really in 2020, really amplified it in March when we all entered the pandemic, recognizing we needed to do something quickly. And so that's when we decided we needed to take a deep dive and look at opportunities to really move forward our workforce and recognize that turnover and this burnout wasn't just an HR problem. We engaged our partners in operations and finance and making sure that we were all on the same page, knowing we needed to tackle this problem together. We also recognized that we needed data to help make informed decisions and making sure that as we shifted, we brought the whole organization along with it. So when we started, we decided that we needed to create a shared vision and understand what goals we were working towards to solve. Our vision was what was considered pretty simple, but more complex to execute. We wanted to use data and technology to simplify clinician workflows, of course, improve retention and enhance staffing visibility across our network. And we wanted to do that by reducing our cost, increasing our patient satisfaction, and making sure we had an enterprise-wide staffing solution as we embarked on our journey. Our goals were also pretty lofty. Again, data was important to us. We wanted to make sure we weren't just making decisions by the seat of our pants, that we really had informed decisions. We wanted to identify a root cause of what was causing our turnover. Pre-pandemic, we were still above the national average, and so wanted to make sure we understood and really put solutions in place to address those concerns. We wanted to implement scheduling tools and make sure that our employees had the opportunity to choose schedules that was best for both them, their families, and of course the organization. And we wanted to move away from a siloed staffing mentality, each floor staffing their own, working off spreadsheets and clipboards that I know many of our departments still do out there, and then shift transparency, understanding where our needs were, and then really enticing our staff to pick up those highest demand shifts so that we can plan accordingly for our patients and their engagement. We were highly dependent on agency traveler utilization at the time. And so our goal, of course, is to reduce that traveler spend and really help drive our optimum staffing throughout the organization, and of course, improve our patient experience. When we've got good staffing, our experience for our patients is much better. So we started looking for a partner, and that's when we discovered AMN. They really had the opportunity to listen to what our needs were, understand what our challenges were, and implement a system that would really help address those needs. They listened first. They wanted to know what our struggles were and understand how the technology could really help improve that experience for our staff. The first thing we did was do an analysis. Where were we at that time? What did our staffing and skill mix look like? Really understand what our core levels were and what they needed to be. And then, of course, align those core with our staffing needs at the highest demand. We did an operational assessment. What we had in paper and policy was that was really happening on the units as they were staffing, and making sure that the work rules and policies were supportive of how we needed to optimize our scheduling tool. And we also leaned into AMN on best practices. Now, remember, we implemented this during the height of the pandemic, so we needed to be very, very flexible and understand what we did 2 years before or a year before wasn't going to be the solution at that time. And so AMN and Smart Square was very flexible in meeting those needs at the time, and then readjusting as we worked ourselves out of the pandemic and bringing us to the next level. We then deployed the Smart Square technology that was really aligning our patient demand with our workforce needs, and really taking a deep dive and giving visibility and transparency to our leaders and to our staff to understand where the shifts were that were needed to be open, and really allowing them flexibility to pick up those shifts to best suit both themselves, their families, and our needs of the organization. One of the most important resources that we launched was our Resource Management Center. That's our central hub that optimizes our our staff workflow and aligning our in-the-moment needs with what available resources are, and being able to deploy them at a moment's notice, and recognizing where we can shift staff. If we're overstaffed in one area, we may be understaffed in another. And if those skill sets align, we can make those adjustments in the moment to make sure that our patients are taken care of. So that's not the end, right? This is a journey. And so we also implemented and lean on our workforce planning dashboard that uses data and analyzes those opportunities to make sure that we're optimizing our staffing and really understanding where our gaps might be and how we can go about filling them to the best of our ability. Again, taking the reliance off traveling staff or agency staff, and really putting the opportunity in our core staff's hands. So coming out of the pandemic in 2022, like I said, our journey was not done. I remember vividly sitting in a conference room going over our workforce analysis from the previous months. And there was a collective gasp in the room when we discovered that our turnover had spiked, and we were looking at running out of nurses by the end of the decade. And so that was a true call to action for us as an organization. We were losing about 30 nurses per month while only bringing on about 15. And that, of course, was not a great trajectory for us. And so that was our true call to action in that meeting. We were in there with our finance partners, our operations partners, our nursing leadership, and collectively recognized we needed to do something, and we needed to do something very quickly. So we had mentioned earlier that this was a not one-size-fits-all strategy. So we had the technology in place, we knew where our gaps were, and now was our opportunity to really brainstorm and understand what can we do to change this trajectory around. So what did we do? We took a step back and we listened. We created an organization called the Culture Crew, which is a grassroots cross-disciplinary employee group that included representatives from across the organization. We wanted to hear from our employees what was causing this turnover. Why were people leaving us, not only from the nursing world, but also in our ancillary staff and our support services as well. We asked the hard questions. We surveyed our employees and wanted to find out what was important to them and what could we change as an organization to re-engage them in our mission, vision, and values. And we took that feedback, combed through it, and answered every single one of the questions that came to us. Some of them were ideas that we just simply couldn't implement. Other ones we absolutely could. And so we took that feedback and really made a change. For example, we increased our tuition reimbursement to the $5,250, the federal limit, and offered it not only to our full-time and part-time employees, but a portion of that to our per diems. We wanted to invest in our staff to make sure that they were continuing to invest in themselves, and then in the future become clinicians or other hard-to-fill jobs by us helping support them in that journey. We also made some policy changes, taking a look at our attendance and tardiness policy, and really giving some flexibility to our leaders on how they administer that. So those were really difficult decisions to make as an organization and as human resources, but we wanted to take with the feedback that we received and really provide good answers to our staff and being very transparent in those answers. We also recognized that leadership visibility was important. We had been working in firefighting mode for so many years during the pandemic. We wanted to take a step back, make sure our leaders were visible, give them very specific expectations on how to engage their staff, and take a lot of other things off their plate that may not be quite as important. We started our journey to be a people-first organization at that point. We had CEO-led listening sessions to communicate what our strategies, to really understand and listen to employees and hear what their concerns were. Again, visibility was really important, and we created very personal touch points at every level of the organizations, from onboarding to our daily huddles to our rounding with staff. It was done with purpose and with intention, and really wanting to make sure that our onboarding process was as smooth and transparent as we could possibly make that. Last but certainly not least, we invested in our workforce development. We have an amazing leader and training program, as well as a high potential program to really understand that our growth is from within, and that we give employees who want to be a leader the tools and skills to make sure that they're ready for that next step. Or if they're not quite sure if leadership is a journey, they want to be an individual contributor, that we also find those high potential individuals and give them those same tools to make sure that they are prepared for the next step in their journey. We also created a robust apprenticeship program with many of our hard to fill areas. Our certified nurses assistant trainee program has been very successful and has garnered not only CNAs, but people who continued in their career path with our tuition assistance and our scholarship opportunities to become registered nurses. We also have an MA training program, as well as surgical technicians, ultrasound techs, neurodiagnostic technicians, and our latest launch is our child life specialist. So again, taking a look at where we could develop our own internal pipelines and giving employees the resources and support to fulfill their career goals while maintaining employment within our organization. We are pleased to see that over 36% of our open positions are filled internally with internal movement. So that is really a testament to our internal workforce development and making sure that we provide great career paths for our employees, whether they're starting with us in our patient safety assistant world or our care aid world, that our teams are supportive of them in their journey within healthcare. I love this graph. It shows really where we came from. As you can see, in Q3 in 2021, our registered nurse turnover was well over 40%. Until it's been a downward trajectory over the last several years where we are at or below industry rates. And this was not just in our nursing. We saw this similar path for all of our ancillary support services staff as well. So we can see that all of our hard work and dedication has continued to pay off, but we recognize that this is just part of our journey. We're in it for the long haul, and so we want to continue to use that focus and are leaning into our people first strategy and vision to really continue this trajectory and make sure that we are aligning all of our priorities with making sure that our employees are well taken care of. So what are some of our measures of success? We recognized that we wanted to make sure that we were being flexible, that we had a very robust float pool. And that float pool not only consists of our registered nurses, but also our CNAs, our critical care techs, our care assistants, our PSAs, and many other areas that we can help plug and play depending on where our needs are. we saw over 267% growth in that area. And that was really attributed to the workforce analysis that AMN and Renown engaged in to see where those gaps were and making sure that we put our resources where those biggest opportunities were. As we saw on the previous slide, we had almost a 63% reduction in overall turnover. And with that, we saw almost an 82% reduction in our travelers. What I'm particularly proud of in that traveler reduction is that in 2024, we actually converted 42 travelers to core staff. And I think that's a true testament to the culture that we've created at Renown, that we have invited travelers to see what we're all about and really embrace them and convert them to that core staff. And we've had very significant success over that, and we continue to see that as well. In addition to that, we've seen almost a 15% growth to our core staff as well, making sure that we are well suited for our future and continuing in our growth pattern to make sure that we have the staff to take care of our patients' needs. The engagement result chart also shows that call to action in July of 22, we saw a significant decline in our overall engagement. And really part of that call to action was putting in those retention initiatives I spoke about. And we're still seeing the fruits of that labor over the last several surveys. We are seeing a continued growth of our overall engagement, bordering on the 75th percentile, and really seeking to achieve even higher in the future. So, very different story from 2022. The good news is, as we are on the right trajectory, our goal is to meet all of our needs, if not before, but in about a year and a half. We expect to be fully staffed with core individuals. I am pleased to say that we have opened our new grad job requisitions recently, and we had a record number of people apply to us from across the nation. We had over 240 applicants, which was our highest we've seen in our history at Renown. So our message is getting out there. Renown is a great place to work, and really leaning into our people first strategy and understanding that we need our people to be successful in taking care of our patients. So today, our net gain is over 6 nurses per month. That will lead us to being out of our agency staffing in, like I said, about a year and a half, and really helps show that we are aligned to a common mission, vision, and values by putting our people first. With that, I'm going to turn it over to John to go over the workforce planning dashboard.
Thank you so much, Suzanne. And thank you everyone for being able to attend this session. I greatly appreciate your time for listening to us. As you heard from Suzanne and Tyler, the workforce planning dashboard has been a key piece of Renown's growth over the last few years. So I want to take a little bit of time to go through the purpose of the workforce planning dashboard and the design and different elements and features that really made it a powerful tool for Renown. So our first thing, our vision really with the workforce planning dashboard was to have a tool that is not only intuitive, but also a personalized platform that really simplifies the complex enterprise data within our organizations that we partner with into actionable insights that becomes a single source of truth. And that's really key. We have a lot of siloed data across our different partners. And so this really brings all that data together so our users don't have to go to different stakeholders that own that data and bring it all together. This creates a single source of truth platform for that. And additionally, it's not enough just to get all that data into the right place, but it's also important that we're getting the right data to the right person so they can make the right workforce decision. That's really key. Some data that may be more valuable to an HR leader may not be as valuable to a finance leader. And so we really didn't want to take a one-size-fits-all approach. We want to make sure that we're getting content that is personalized to that persona so they can act upon it to make the right workforce decision. Now here you can see our workforce planning dashboard. As I said, trying to get the right data to the right person. And so what you see here right now is the HR persona page, but we have a unique page for each of our 3 key personas. And with these persona pages, we have a simplified design approach with this, while also taking that persona-based content approach. So in the top, you will see a variety of different KPI cards that our users are actually able to personalize based upon what is most relevant to their business objectives at that time. So it's not just a one-size-fits-all, like I said. We're really designing for clarity and focus to make sure the content is tailored to that specific persona. Additionally, you heard Suzanne talk about different goals that her organization had set. And in our KPI cards, we are making sure the dashboard is supporting your goal alignment. So you're able to track that progress against your KPIs. So you're able to stay on track as an organization with your workforce planning objectives and identify those areas for improvement. And then lastly, the piece I want to touch on within this is we know that our users are very busy. We work with a lot of high-level executives across nursing, finance, and HR, and they don't necessarily have a ton of time to comb through the dashboard to really determine what those insights are. And so we've actually implemented automated recommendations within our dashboard. So we include recommendations that are powered by AI and the different intelligence pieces that our consulting team has created over the years. And this really helps our users make those data-driven decisions more effectively for their future workforce needs with the limited time that they have available. So our goal here with those recommendations are going to be to allow you as a user to cut through the noise with data-driven AI intelligence to go from data to decisions faster than ever. Now, one of the hardest things that our users often have is still being able to see the kind of macro level of their information while still be able to get down to that micro level to understand what is driving those KPIs. And so our users have the ability to drill down further into their KPIs to better understand what is driving those KPIs. So in this drill down, we've organized our data view here to be able to help you understand where is that KPI happening within your organization, when is it happening historically, so trending that over time, who is driving that KPI? Is it certain seniority bands or age bands? You heard Tyler talk about the different importance of seniority driving KPIs around turnover. And then also, who are the actual employees that may be driving those KPIs? You know, who has significant level of overtime? Who has high levels of leakage? Who are the employees that have left our organization over the last period of time? And then, as I said as well on the AI piece with recommendations and action items, it's important to understand why and how we can address those KPIs. So how can we address turnover? And the variety of different ways that Suzanne was able to reference with Renown, we want to be able to give our users those tools to be able to navigate those goals that they have and have effective approaches to drive those KPIs so they can achieve their goals, whether it be patient satisfaction, employee engagement, and safety, for a variety of different reasons. So within this, you'll be able to have clear, actionable insights to really help you make informed decisions quickly and efficiently. And this leads to better resource allocation, improved patient care, and optimized workforce management. That being said, Suzanne, I'll have you take over the next slide.
Wonderful, thank you. As we discussed earlier, it isn't the end of our journey. We had mentioned we've redone our mission, vision, and values recently for Renown Health, and we actually added one people first as part of our core values. So really putting in the forefront, the most important resource is our people. We want to make sure that that is aligned with all of our decisions that we make as we continue our journey. Our workforce optimization, again, we continue to enhance and support our float pool to make sure that they are supporting our acute care centers to the best of our ability, and really, again, reduce reliance on traveling staff. The resource management optimization too. There's always an opportunity to streamline and support and change processes. So again, it's a continued work in progress, but really focusing on the right person at the right place at the right time at the right cost, and to improve our alignment and strengthen our overall operations. We've also engaged quite a bit with AMN, looking at our incentivized shifts and making sure that they are right-sized with the needs of the organization. And last but certainly not least, we are looking at and are working towards a July implementation of our scheduling tool expansion to our medical group and urgent care sites for our medical assistants, patient access reps, and those support services in those areas. And we're really excited about taking that next step in our journey and bringing it out to our medical group clinics. So excited about those next steps. So with that, I'm going to turn it back over to Mariah to answer some questions.
Thank you so much. This has been such an interesting presentation, and I think the audience agrees because we've got plenty of questions to go through for the end of the hour. But let's kick it off with this one. How did you support your leaders so they could retain the core staff they had?
That's a great question. And really, we wanted to first listen to our leaders. So in addition to doing listening sessions with our staff, we also listened to leaders and understanding where they were spending their time, and was it impactful, and was it important? So our goal was to take the things that aren't necessary off their plates to make sure that we could give them the time in the day to do things that made the biggest impact. So that was first and foremost. We also have an amazing HR business partner team that works really closely with our leaders to make sure that we understand and take obstacles out of their way to make sure that they have the time and effort to focus on employees and their engagement. So our first and foremost was listening to our leaders, adjusting some of our policies and procedures and their responsibilities to make sure that they can focus on what's important, and that's with our people and our patients.
Excellent. And this next question is a little bit in the same vein, but it asks, was there a key learning or an aha moment from your CEO-led communication sessions or the culture crew?
Yes, my aha moment is listening through that. It's the little things, right? It's understanding what their daily focus has been and taking the little obstacles off their plates. It wasn't some like grandiose process change or implementation. It was sometimes even the little things. For example, identification. Badge buddies became a very important topic of conversation in those areas. Really taking a look at our reward and recognition program, and are we recognizing and rewarding the right behaviors, and really taking the time to listen, and the appreciation of simply asking the question, although we may not have been able to change everything they asked or implement everything they asked. The simple idea of simply asking was probably the most important. And understanding the whys and why nots, we could or couldn't implement some of their ideas.
Perfect. Now, going back to what you were saying about the float pools, this next question is, how have you made sure your float pools have competency to work in different units?
A very good question. So we have a wonderful clinical education department that ensures our competencies are aligned to the areas in which they float. And in the Smart Square tool, employees can validate their competencies. So our resource center can ensure that wherever they're floating our staff, that they are truly competent. So our education team validates competencies. Each individual nurse has their own profile so that our resource team can also ensure that they are getting floated or they're picking up shifts in areas in which they are qualified.
Excellent. You've shared some really interesting results for nurses. But the next question asks, are you doing anything similar for other providers like physicians or APPs? And if so, were there different tactics for these employment groups?
So yes, we have seen very similar results. We were in the double digits turnover-wise for our providers, both APPs and physicians. We were hovering between 15 to 18%. We are down to the single digits now. We are around 6 to 7% in those areas. And we used very similar tactics. Listening sessions, now we had to be creative a bit in the timing because we know we want to make sure our patients are taken care of. So there was a weekend session, a strategy session with our CEO of our medical group and our HR team, and really took the time to do breakout sessions and understanding what was important to them as well. But it's really the same strategy, maybe a little bit of a different tactic to accommodate their particular needs.
Wonderful. So we're going to give you a moment to breathe, Suzanne. I've got a question here for John. John, can the dashboard help us identify and address root causes of staffing challenges?
Yes, absolutely. As you probably were able to see when I went into the drill down, where you're really able to help understand is the different demographics of who may be driving those different KPIs. So what might be driving turnover? Tyler went through a couple different examples of what are some of the biggest contributors. And so you're really able to hone in on those different areas to understand where, when, who, how, and why with those different KPIs. And so that's why we wanted to give that ability to drill in and understand what is most contributing to those areas of focus that you may have.
Perfect. And then the next question is for you, Tyler. What is your recommendation on the first step that a healthcare system should take when implementing a similar approach as Renown did?
Thanks, Mariah. I think to highlight what Suzanne talked about consistently is talk to your people, gather feedback from where we're going through, understand why and what is happening today at the bedside, understand why they have created processes that may be outside of your standard or outside of your policy, and listen to specifically what challenges these have created for them, and then take those challenges and take that feedback from them and use that to build out the process moving forward. Build something around what they are. This is not a one-size-fits-all approach toward everything, and something that works for Suzanne's team and Renown may not work in other parts or other systems across the country. And so I think that's the most important part is understanding where you're at today to be able to understand where you want to go.
Oh, that's perfect. I love it. All right, Suzanne, back to you because we can't get enough of your beautiful voice. This question asks, does Renown use engagement survey data? And if so, do they have good participation?
Yes, we do. We use a survey through Perceptics, and that is both an engagement survey and the patient and the culture of safety survey. Our participation is always over 80%, which is pretty phenomenal. And we also do the annual survey, and then we have also started implementing a pulse survey as well in between. So our survey annual is typically in June, our pulse is in December, and it's not the full survey, but it's just to make sure we're still on track with our engagement results. So yes, great participation, really robust feedback, and I think we get that because we are transparent with our results and really want to make sure that we are answering those questions.
Perfect. And then this next question asks, what positions have you found the most difficult to fill, externally and internally?
Yes, those, very good question. So of course, experienced registered nurses are always difficult to find, which is why we've really looked into our traveler conversions because we want to sell them on Renown. We've also had all of the apprenticeship programs that we developed was really designed around those areas of greatest need. So our most recent success has been our ultrasound echo in particular specialist training. So we created apprenticeship program through that, neurodiagnostic techs as well. And then respiratory has been particularly difficult to find too. And our director of respiratory has recently partnered with a local college to develop a respiratory program first in the state to really help address those needs. So Renown's been very focused on developing internal pipelines and community pipelines to help serve those populations.
Perfect. This next question asks, have you implemented moral distress forums for staff, resiliency training, and code lavenders for staff support?
Yes, so we have a CISM team, a critical incident team that responds to incidents within the organization that employees may need some debriefing. It's a very amazing team. They're on call and respond in a moment's notice. We also have implemented the RISE team as well, which is a 24/7 opportunity. So if we have employees who are struggling with a particular situation, the RISE team are a group of volunteers that answer the call. And then we also have a care cart. So if there's a department or an area that might have some challenges, we will deploy a care cart to make sure that we are focused on their particular needs as well. Our leaders are amazing and never hesitate to outreach if we've had a difficult situation in any of our areas to lean in for that support. We also use our employee assistance program quite a bit, and we've got free mental health consultations through our health insurance program through Teladoc.
Perfect. Let me see. This next question asks, Renown, having gone through this entire process, what is your best takeaway recommendation to other healthcare systems?
I would start with data. You can't have any good decisions without knowing where your problems are. So start with data, understand what those problems are, and put together some realistic solutions. I know we wanted to solve the problem in months, right? But as you can see, it's taken us 3 years to get where we are today, and it's still a continued work in progress for us. So data is most important. That really helps underline where you need to put your efforts and really help drive those business decisions and get the biggest bang for your buck.
Excellent. Well, I think that will be it for our session today. Thank you so much, Suzanne, Tyler, and John, for this excellent presentation. And we also want to give a special thank you to AMN Healthcare for sponsoring today's webinar. We hope you had a great time like we did, and hope you have a great rest of your day.